Advanced Nursing. How are you today? I'm going to take you on a little tour of our nursing department, and we start here in our office and discuss any topics or questions, things that you have questions about transferring in credits or anything like that, and then I will take you on a tour. Shall we head out the door this way? So this is our Center for Health Education, and nursing is, all of our classes are here, starting in their junior and senior year. This is our faculty hallway. You will have a faculty advisor when you're here in our program, and we have 14 full-time faculty that teach their specialties that they've worked in. When we come around here, we're heading out to our commons area. We have our resource room, which is interconnected to our library. Students will study in here, and if they need anything from the library or main campus, they're able to use this. This is our commons area where students will gather to eat hot breakfast or lunch, which is served here every day in our cafeteria. Typically they're here 8 to 3 most days for their classes, but they gather here to eat. Down this hallway is our classrooms. This is our computer lab. So the students will use this to take a lot of their testing, especially getting ready for that NCLEX licensing board. They practice using HESI tests, and that is integrated through the whole program. So while they're here, they are getting ready to take that licensing board. Across the hallway is a regular classroom. The students sitting here, they can set up with their laptops. Professors come to them, which is really nice, so they're not having to move all of their stuff. But the class sizes are small, as you can see, so they know their professors on a first-name basis, which is great in an intense program like this, especially if they need help, individualized attention, they get it. St. Ambrose is great for that. So follow me this way. Down this hall, I'd like to show everybody. This building was built in 2010, and it does house other graduate programs along with nursing. So there's lots of students in this building at any given time. And we do a nice job with our interdisciplinary days, where the students from all the disciplines, whether it's our occupational therapy, physical therapy, assistant or physician assistant, education, speech language path, social work, they all gather together and they work on case studies. So the students are very used to working with other disciplines, which is great. This is a nice study lounge. The students use the building, but this is a great resource area for them. And there is computers, scanner, copier, as well as a place that they bring their own food to heat, microwave, toaster, so they do use the building a lot. And they can stay here until well into the evening and study it in groups as well, which is very good. And back this way, we're going to head to our skills and simulation labs, where the students are learning all the skills that they need to be a nurse. Our simulation labs use high-tech mannequins, and they are controlled by laptops, and when they are plugged in and working, it's like the students are dealing with a real patient. So they will have a case scenario, they'll know what the patient has, they'll get report from the faculty member, and then they go in and work on those mannequins, and I will show you that right now. Around the corner here, we do have lockers. The students like to get a locker, and they can use that and put their books or a coat, or if they bring a lunch, they're certainly welcome to do that. When the students come in, they have either their certified nursing assistant certification, or they have a work equivalent where they've been doing equivalent CNA skills, and they come in and build on those skills, and they use this lab. So these are areas where the students will come in and do their health assessment class, as well as learn all of the skills that nurses need to learn, from starting IVs to inserting catheters, to doing injections, chest tubes, tracheotomies, all of those skills that are needed and done by nurses. So they learn all of that in here, as well as health assessments. We have in-house clinicals as well, where we bring in healthy little ones, children, pediatrics, and expectant moms, so they will work on them as well and do health assessments. So that works out really nice. And then the students work on each other. And like I said, we have many mannequins and models that they practice. We have all of the equipment that they need, from the latest IV pumps and tubing and all of that. So they get their hands on and learn. And the students find that that is always the best. When we come across the hall, we have our simulation labs. And this is where the mannequins are high-tech. We were fortunate enough to have 9 of those simulators. This is one of them. And we have simulators that are aged across the lifespan. We have a newborn infant, as well as we have a pediatric. We've got a 1-year-old and a 5-year-old. And we've got adults as well. But this is little PD Hal, so they can do simulations on him. And we will have also people posing as their parent or guardian. So the students, when they're in here working, they are doing whatever they need to do for little Hal, and whatever the parents may have questions about the care, the treatment, what the doctor said, what does that test mean. So the students really have to know their stuff. And then they have their laptops here, just like they would in the hospital, to do their notes, look up orders, all of that. So they have to practice all their protocols like they would if they were in the clinical situation. So they always love this because they just learn. It's a good way to make mistakes because it's on the mannequin. So when we go across here, okay, we're going to head into the control room. This is where faculty will sit. The students are behind the mirrored glass with the mannequin. This screen is beamed down to a classroom down the hall where the rest of the classmates are watching and getting ready to rotate into the actual simulation. So they will all take turns and have their hands on. And it works great because it's very interactive. So they're acting just like this is a real patient with whatever the symptoms and whatever they've been told that the patient has been diagnosed with. So they may give meds, start an IV, anything else that they need to do.
Four-star restaurant quality or anything, but it wasn't too bad. You paid more than a 4-star.
Here we are at our debriefing room, where students will sit and watch the simulation if they are not actively participating in the simulation. It works out great. They get ready to rotate into the simulation and do their part and get their hands on the equipment and work with the patient. And then they get to watch and see what's going on, so they know what they have to do next. The students love it, and they get to be actively involved all the time, so and get their hands on. And that's the end of the debriefing room.
Too small for.
Thanks so much for visiting. We're excited to have you come again, and we hope you enjoyed the tour of our Center for Health Sciences Education building. Thank you.